Luiza Petre, assistant professor of medicine at Mount Sinai Hospital in New York. So, doctor, break down the coronavirus numbers for us right now in the U.S. Which states are currently hotspots?
Natasha, so far related to the school opening, we had a surge in 50 states reported with about 40,000 staff members and students testing positive. And this was mostly related to social gatherings. However, the highest states are Miami, South Dakota, and Arizona.
How are things looking since students have gone back to school and university?
As I said, a lot of surges have happened in the last 2 weeks. In New York State, we haven't opened. We're only in the first week, and we haven't seen there is a lag behind exposure and reported cases. And we are still below the benchmark of 1%. But as I said, so far, 50 states have reported an increase of cases related to schools.
Have you seen an increase of patients in your hospital specifically?
In New York State, we have been pretty below 1% benchmark, and we have been very compliant. We learned the lesson early on, and New Yorkers were pretty good about it. We're one of the best states. But however, with the fall season coming and schools reopening and after Labor Day, it's too soon to report the new tally.
Are people sticking to the rules in the U.S. right now? Have they finally understood, the severity of this crisis?
Natasha, there are many behavioral patterns across the states because this became a political issue and a political statement. And if you put that together with the quarantine fatigue, you kind of create a perfect storm. For instance, South Dakota saw a 20% cases increase in 2 weeks after a bike rally.
But what is the public discussion right now when it comes to the coronavirus? Are people just fed up? Do they believe that this is a severe issue?
That definitely plays a major role, the quarantine fatigue. It's been already 6 months we've been locked down, working from home, and mostly young people are totally looking forward to socialize and get back to school. Absolutely. And as I said before, the political statement also it's big into play here.
Now, we saw that the Oxford vaccine trials were paused because, one of the participants, fell ill. Is there any update right now from the United States when it comes to producing a vaccine against the coronavirus?
Natasha, this is not uncommon on big trials to halt and to do a safety investigation. This happens quite frequent. So it's just a safety procedure. However, the other two trials are still ongoing. We're talking about Moderna and Johnson & Johnson vaccine makers, but they still slowed down enrollment because we don't have enough minorities. So far, we have only 1/3 of the participants.
Now, as a doctor, I'd like to ask you, what do you have to say to young people who feel that, the coronavirus is not really a threat to them, that they really can't be impacted, that if they get sick, there really is not going to be any type of long-term impact?
This is totally wrong. That's all I have to say. And I understand that people are getting into denial at this point and being tired, but nothing has changed from 6 months ago. Wear your mask, keep your social distancing, because this crisis is far from over. We're in a long haul for this.
Are there long-lasting impacts on the people who do get the coronavirus, health-wise?
Unfortunately, we see more and more about 30% of people having long-term consequences from the virus.
Wow. All right. That is actually a very big number. Doctor, thank you so much for joining us with that breakdown. We are out for a short break now, but